I always have my sticky note there just to make sure that I hit the record button. So thanks everybody for joining us this evening. We're very excited to have Joanne Jones with us here to give us a presentation on oral telehealth, assess, capture, and connect. This is great. So thanks everybody for joining us. So let me go to my next slide here. Just a quick introduction for myself. My name is Wendy Jobs, and I am manager of dental hygiene practice for BCDHA. I currently live in Kelowna. I work remotely, as a lot of people in the world are right now. And I have 3 grown children, and my husband and I live with a wonderful, beautiful, I always say, another day in paradise. We love it here. Just a quick tutorial for those. I'm sure since COVID has engulfed our lives, we certainly have become much more familiar with online access. So for those that are not familiar with Zoom, you can certainly see that at the bottom here. Oh, hang on, I'm not. Oh yeah, that's right. You can see my screen, right? Okay, good. I suddenly had a panic attack there that maybe I wasn't sharing it. So we don't have the raise hand feature, but if you want to ask a question, certainly use the chat function here. You can type in your question for us, and if you send me questions along the way, I'll try and get Joanne or myself to answer them at the end of this. You can test your speakers. You have audio settings here, so you can control. No one has video for any of our attendees, just Joanne and myself, and you can control your speaker and test your audio here. And there's the chat box, and that's where you can put your question there. So just for your information, these are only suggested competency categories for your CDHVC online credits. You can certainly use those or other ones that might seem to fit your professional development needs. And I am going to let Joanne Jones introduce herself, and I'm going to turn it over to Joanne. So Joanne, thanks for coming. We really appreciate your time and energy to bring us this information. And oh, before I also want to share one thing, Joanne and I got to know each other when she lived in Kelowna for a short period of time, and we became friends. So I really appreciate our relationship. She's a very valuable resource to myself. And we got connected, and that's how I learned about the Telscope and the throat scope. So I'm going to turn it over to you, Joanne.
Thank you very much, Wendy. Let me just bring my screen up and...
Yep, looks great.
Except we're at the end of the presentation, and I want to be at the beginning, so just hold on here.
No worries.
Hold on. Okay. So before we get started, I just want to say thank you very, very much to you, Wendy, for the privilege of being able to talk to your members and to speak on a subject that is very, very interesting and exploding exponentially at this point in time. So I will share my screen here and get started. Okay, so that should have my screen up now, ready to go.
Yep, you bet. It's good.
So welcome very much to the webinar entitled Oral Telehealth, Assess, Capture, and Connect. We know that over the past few months, things definitely have changed. We know that there has been a strong impact on our profession of dentistry and dental hygiene specifically. Telehealth, and specifically when we look at oral telehealth in this webinar, has been the biggest change that has been experienced according to industry experts. Before we get started, there is a little bit of housekeeping that I want to communicate with you. There is a handout available to you. For myself, you can read on the screen here. I've been a busy lady over the last few years. I've done over 1,000 presentations across Canada, the US, England, Ireland, and lovely Bermuda. And of course, over the past few months, everything is being virtual. So it's so nice to have an opportunity to chat and have some personal comments when we're doing a webinar because we miss that live interaction. I am one of Dentistry Today's CE leaders and have been for the last 10 years. And I really do pride myself in the provision of clinical resources so that you can facilitate knowledge translation into practice, because it's one thing to learn something new. It's another thing to finish learning and be able to translate it into practice and really feel that you've accomplished something through your learning experience. So that is always, always my goal. My information, my email is in the handout and will be on the last slide as well. And please, please always feel comfortable with reaching out and sending me an email if there are any questions that you have. I'm always happy to hear from you. So a very quick disclosure statement and disclaimer. I am an advisor to Holland Healthcare. And who is Holland Healthcare? Holland Healthcare is a developer of Telescope, the oral telehealth system, and ThroatScope, which is the world's first all-in-one illuminated tongue depressor. And Jennifer Holland is the founder of the company and just a brilliant young woman with a clear, succinct passion for making the world of medicine and dentistry an easier place for us all to grow in. The webinar was developed to elevate awareness of the growing use of telehealth, and specifically oral telehealth and its integration into clinical practice. But one thing I want you to keep in mind is that although we are talking about oral telehealth, this foundational platform may be translated to any facet of telehealth. So whether it's telemedicine, whether it's teledentistry, and we're kind of honing that in tonight to talk about oral telehealth, because sometimes I think we get to the idea of teledentistry and we forget about the other role of team members in the provision of a telehealth. One of the disclaimers that I really want to be clear about is that we are advised, it's a prudent measure to consult with our respective regulatory authorities to ensure that guidelines and standards of practice are adhered to in all facets of telehealth. So teledentistry, telemedicine, oral telehealth is another means of delivering the service, but the service always has to go back to our standards of practice, and that is critical for us to be able to internalize and follow that guideline. The learning objectives upon completion of the webinar, my hope is that you will be able to understand the relevancy and the benefits of incorporating oral telehealth into clinical practice. You know, perhaps you are coming here with an open mind and don't really know too much about telehealth, but are interested in the concept of it. Or, you know, maybe you have started to incorporate into your practice. But at the end of it, I'd really like you to be able to understand what the features are, what the benefits are, and what the relevance is to your practice. I wish to explain the process of image capture, subsequent assessment, and the management pathways. So what do you do once you do find an issue in a telehealth consultation? What are the management pathways? What is the guideline to follow, and developing a workflow plan for integration into clinical practice. So at the end of the webinar, you have an idea of the different avenues that you could pursue. I'm not going to try and pigeonhole anyone into a specific pathway, but give you, on the other hand, guidance into some of the different pathways that are available at this point in time. So Wendy, with that, if you could please bring in the first polling question, and Wendy will explain how this works for you.
Sorry, I had to take my mute off. I'm just going to launch a polling question, and you can just use your computer mouse or your screen to tap on what you would like to show us as your answer to the question. So I'm going to launch. So there, it should pop up on your screen. So how likely are you to incorporate telehealth into your clinical practice at this time? So I'll give everybody a few seconds here to make your decision. You can change your answer if you hit the wrong one or click the wrong one, you can change it. It allows you to continue to change until I end the polling. Okay, I don't see any more changes. I'm just going to end the polling and then I'll show you the result. Oh, no, one more else just popped in there. Okay, I'm going to end polling. I'm going to share the results. Can you see that, Joanne?
Ah, perfect. Yes, I can. So the majority of you, almost half, not likely, just wishing to gain more information at this time. I love that, because if everybody said definitely interested in initiating the process into practice, then there's not really much to learn. You're already
Right.
on your way. So I think this is fantastic. This is actually what I was hoping for. So
Okay.
somewhat interested.
Oh, sorry. Do you want me to
That's
go back?
okay. But
Do you
I
want me to
think
go back?
in order of it, so somewhat interested, about a third, and almost a quarter moderately interested and planning on incorporating in the future. So very, very good. Pleased with that. That's awesome.
Okay.
So I want you to look at the big picture. I think over the last few months, I hate to even bring up the subject, but we have all been consumed with PPE and infection control procedures. And, you know, some days we feel like we're drowning. However, what I want you to really look at in this webinar is the big picture, because always in adversity, there is an opportunity. And the opportunity that exists is a means of communication that we may not have considered in the past. And if Wendy and I had talked about this, you know, maybe back in March or April, I would have said, yes, you know what, it's interesting. Telehealth is interesting, and it's something that maybe we should have a look at, and we can certainly discuss the conceptual platform of using telehealth. But at this point in time, I can say with 150% confidence that it is not just something that is interesting. It is here to stay. It is a critical component of our clinical practice. And if we don't integrate it into practice, we are going to be left behind. And I'm going to discuss some of those influencers and some of the reasons that I've said this. But as I mentioned in the opening, this is one of the fastest growing changes that has been a result of COVID-19 that we have experienced in our community of dentistry and dental hygiene. So what is oral telehealth and teledentistry? And I do see some questions coming in, and we're going to leave those to the end. And I'm not going to talk forever because we want to give you a nice amount of time to be able to ask specific questions. So what is telehealth and teledentistry? And I want you to really notice this first quote. I've put the date there just to make a point here, because this goes back 20 years ago. And when you look at it and the statement, teledentistry is a rapidly forming subset of telehealth, a field that already has considerable impact on the healthcare industry. Technologies currently available are beginning to change the dynamics of dental care delivery. It now involves consulting experts using the internet. Wow, using the internet. You know, 20 years ago, this was something. Think of your own life 20 years ago. What was it like? And think of where you're at today with technology. Just take a moment to consider that. So this is not something completely new, but the capabilities and the functionality are, it's just limited by our own imagination and our own ability to be creative. Teledentistry is the provision of patient dental care at a distance using information and communication technology. So that's kind of a standard definition of teledentistry at this time. Teledentistry was initially regarded as a promising path for access to care comparable to face-to-face for oral screening, especially in school-based programs, rural areas, areas with limited access to care, certain demographics, and of course, long-term care facilities. So in a way, with maybe a certain type of method of teledentistry, we have already been incorporating some of this into our practices, maybe not calling it that, but we actually have a degree of functionality that is present in our practices. But now we can move to that next echelon. COVID-19 has catapulted its use well in advance of its anticipated popularity. And all the references are included at the end of your handout. And that reference actually coordinates with an article that I wrote that was a feature in Oral Health back in May, I believe it was May or June. And it was called Socially Distanced Dentistry. And it talked about dentistry being so social and some of the stumbling blocks and barricades we were experiencing in order to remain with that social contact with our client base. And that's where the subject of oral telehealth entered and made such a big impact, or has made such a big impact. So let's look at some of these figures, and some of these are not too encouraging, but again, in adversity, there is opportunity. So let's keep that in mind and not be discouraged, but look at what the opportunities are for advancement. In a recent poll, 50% of adults reported they or family members skipped their dental and medical visits due to COVID-19, despite a surge in going out and shopping and going to restaurants and visiting family or going back to work. So there was still that stigma that was attached to, or that fear or apprehension that was attached to going to a medical or a dental facility. Even though the majority of dental practices have reopened, industry experts warned that a complete bounce back from the pandemic isn't likely in 2020. And, you know, as we look at the news that we are seeing from day to day in North America, you know, and in some areas in particular, very, very heavy onslaught of more and more cases. So it isn't anything that appears to be on the forefront of ending really quickly. 75% of the public surveyed do not feel safe visiting their dentist for non-urgent dental treatments during the COVID-19 pandemic, according to new data released by an American dental service organization. I do want to point out that this survey was done in May, and I feel that we should give ourselves a huge pat on the back for a lot of the marketing we have done, I don't really want to use the word marketing, but the education we have done to our clients, to the public at large, to assure them that we do have safety measures in place, and we have gone to the ends of the earth to ensure that we are following exemplary infection control procedures. But the fear of their own personal health, safety, and infection control concerns really dictated this response. And the final quote that is one of the influencers is the dental industry has become one of the sectors that has been hardest hit by the pandemic. And I believe we can all relate to that and say affirmatively that we agree with that. Almost 50% of dental practices would not be sustainable if forced to postpone all non-emergency treatments for an extended period of time. And we know that that is a discussion that has had great deliberation over the past several weeks. So oral telehealth principles. Through the use of technological advancements, so not just through the use of the internet, as we saw back in 2000, but all the capabilities with our smart devices and so forth, and video chats and Zoom conferencing and so forth, we're able to deliver an inexpensive solution to the provision of professional advice and treatment recommendations, virtually a customized treatment plan for many of the different dental concerns and dental hygiene concerns that the public will have. So it involves the incorporation of a combination of technologies. There's telecommunication, digital imaging, video chat. Of course, privacy and security must be adhered to in accordance with electronic transmission of healthcare information. So I'm going to go back to, again, remembering that this is simply an alternative method of care, or an alternative delivery of care. So all our standards of practice, all our record-keeping guidelines, all our documentation, nothing has changed. And I think that's where people get really hung up on, oh my goodness, how do I do this, or what can I do in this particular case? And Wendy and I had a great conversation a few weeks ago about the whole dental hygiene process of care and what we can do as a dental hygienist. And there's no difference when we're using this alternate method of delivery of care. We also can have a provision of increased access for certain demographics or underserved areas of the population, which is very gratifying to us. Mobile dental hygiene is such a need in our world. It's not an easy delivery method. Those of you that have practiced in this capacity know how challenging this can be, but you also know how gratifying it is to be able to help these people that otherwise would not have had care. And now when we look at this next level of telehealth that we can incorporate in 2020, we have a capability to deliver really customized care plans to people and feel that we have a connection with them because we're able to, see them in a video chat or however we choose to communicate with them. For many, this represents an actionable step towards improving their oral health that they may otherwise not have initiated. So maybe for our anxious client that cannot see their way into a dental practice, is intimidated by the environment, this is a really comfortable way for them to initiate that process. And they should be congratulated on that. So Wendy, if you would like to bring in the second polling question.
Hi there. Sorry, I was reading the question, but I had myself on mute. If incorporating telehealth into your clinical practice, which clients do you feel would be most likely to use this service?
I know many of you would probably say all of them, but who is most likely? Like in your mind, who do you see most likely?
I know in the past when people have said the polls, sometimes people are doing other things like doing dishes or doing stuff around the house, and then it takes a minute for you to get back to the device to actually launch your question. So it looks like people are done. I'm going to end here in just 1 sec, and I will share results. There you go.
Okay, so 13% clients who are COVID symptomatic. Clients whose health is compromised. Awesome. Awesome. We are absolutely on the same page because there are people that are at risk that would really benefit from using telehealth for many of their, more minor dental concerns that they have. Clients who have a hard and soft tissue concern, yes, I would put that at second too if I was answering that poll. And clients who are fearful of returning to the practice environment. Great. Okay. So about half clients whose health is compromised. Excellent.
Okay.
So no right or wrong answer. It's just kind of to get an idea of how you see this being incorporated into your practice. So when we look at mitigating risk, this is so critical. And I did a webinar actually for oral science a few months back, and I quoted a paper that was published in the British Dental Journal, and one of the authors was Dr. Victoria Sampson, and she talked about some of the comorbidities, and it's a great article. It was actually about a 45-minute webinar accompanied the article as well. So if anybody wants that information, please email me for it, and I'm glad to share it with you. But that really got me thinking about mitigating risk, because a couple of things here. We want to redirect those hospital emergency visits for dental issues back into the dental practice where they're best handled. I saw a statistic a while back, and there are a large number of oral cavity concerns that end up in emergency rooms. And in this day and age, we don't want to have a client that has a dental concern sitting in an emergency room environment for so many different reasons. Many of our clients have existing medical complications that place them at increased risk at any time of social interaction, and particularly at the present time of the current pandemic. So what the webinar that I alluded to that Dr. Victoria Sampson based on her published paper in the British Dental Journal is she talked about some of the cited comorbidities to experiencing severe complications with COVID-19. And they did include hypertension, diabetes, cardiovascular disease, immunosuppression, asthma, and chronic obstructive pulmonary disease, or COPD, and cancer patients. And when we look at our client base that we have in any day, we know that we're going to have clients that have these particular issues. We look at diabetes, for instance, 3 out of 4 Canadians the prediction was by 2020 would have some metabolic glucose dysfunction. So somewhere in our particular schedule, we're going to have a client that is going to have a cited comorbidity, and we don't want to increase their risk. So in order to mitigate risk for some of the more minor concerns, it would be so much more prudent to be able to look after them through telehealth. So potential use of oral telehealth: consultations, review of outstanding treatment plans, assessments of oral lesions, early childhood caries, eruption patterns, an opportunity for collaboration with other regulated healthcare professionals, maybe screening process for disease, for perio, for caries, for oral pathologies. And this also provides great documentation so that we have a record for comparative values. And screening, of course, for individuals in long-term care facilities, school settings, and public health environments. So the use is endless for telehealth. The simplicity, it eliminates the need for treatment room preparation and infection control measures. So, you know what it's like to prepare a room, to don and doff our PPE, and to make sure that we leave that time period in between the room before we bring the next client in. And can you imagine if you have a client, I've given some ideas here, but with maybe the mother has called and said, my child has a second row of teeth erupting. And we know that that is related to the permanent dentition erupting, and the primary dentition is not exfoliated yet. And it would be something that would be so easy to be able to address in a telehealth conference call or video chat, or just sending a picture, than preparing that room and having that client come in. So it's a cumulative time-saving measure. It also allows much more efficient scheduling. When we look at our day sheet, quite often our schedule, we have 10 to 15 minute units that are dangling here and there that are otherwise lost. So a number of different things, I've given you some examples here: abfraction, recession sensitivity, black line stain, oral lesions, and referral management. And again, the golden rule always, if you have a concern, you see an erythroplakic lesion, for example, a referral is necessary always for further microscopic evaluation, or at minimum, a follow-up in 14 days to re-evaluate. And then, of course, apthi versus an erythroplakic or a leukoplakic lesion, and just being able to put our client at ease. So what about the role of the dental hygienist in oral telehealth? Well, as I mentioned earlier, definitely adherence to standards of practice in the dental hygiene process of care applies in this alternate delivery method of care. So our assessment, our dental hygiene diagnosis, our planning, our implementation, our evaluation. Other than implementation, I guess in that area, if we looked at customized instruction for home care, we certainly could do that in a telehealth call, and we could do that very successfully. But of course, debridement, things like that, definitely have to be chairside. What about a post-procedural care call or some type of follow-up interaction? That's a beautiful way to be able to use telehealth and not have to, again, prepare the room and have the client come in. Capability to communicate with dentists if we are working remotely in some of those settings, like rural settings or long-term care facilities, public health, school programs. So the dental hygienist will record all the client information and then collaborate with the dentist, who would then review and treatment plan. So just, essentially like we would do in clinical practice. So this again eliminates that unnecessary trip to the physical setting and limits the requirement for PPE and infection control procedures. It also provides engagement opportunities, an opportunity to review outstanding treatment and elevate case acceptance, alleviate anxiety and apprehension through also the communication of the safety measures and the protocols that you have in place. This can be communicated as well in a telehealth call. It elevates the comfort of dental visits with the ability to connect with a live person and be able to express possibly some of their fears or apprehension as to why they do not have a level of comfort in coming in. From a business side, it provides another revenue stream, and it provides quite a valid and lucrative revenue stream into the practice as well, and at the same time serving your clients. The main thing is viral pandemics are expected to be a way of life for several years. The practice that has oral telehealth in place and is equipped with the capability to offer this service is going to be better prepared to adjust to another cycle that happens. We're not going to get caught without being in a preparatory mode. It's the same with some of the changes that we have made physically to our dental practices. The same thing. To have this oral telehealth in place allows us or enables us to be able to address if there is a second wave or there is something new that actually comes along. What about in a post-COVID world? You know, we're focused right now on where we are with COVID-19, but in a post-COVID world, oral telehealth is going to help activating clients, those that have incomplete treatment, maybe those that have had a change in their employment status and maybe they've lost some of their dental benefits or they've lost them completely. Oral telehealth provides an opportunity to do screening and to be able to do a consultation with them and stress the importance of getting them back in the chair. With our current clients in a post-COVID world, it enables follow-up without chair time. It enables the opportunity to address minor concerns without chair time and, of course, anxious clients. And future clients, what about those people that will call and are shoppers and want to learn a little bit more? What a great opportunity to be able to share your brand. What separates you? What is your competitive difference in your practice? What sets you apart? Or those wishing a second opinion. Again, a great opportunity to be able to communicate and engage with the client. Maybe it could be an emergency appointment, or it might be a client that is seeking a specialty treatment and just wants to find out more about what your practice offers. So always an ability to be able to impart education. So third polling question, Wendy, if you could bring that in, that would be great.
Okay, what method do you perceive to be most valuable to incorporate telehealth into your clinical practice at this time? Synchronous? I'll let you guys read that because those are long answers. So synchronous would be something like Zoom, that we can see and hear each other in real time. And asynchronous, an example might be email.
Exactly, yeah. Asynchronous, sometimes they call that store and forward. So sometimes information from a client is stored to the cloud and reviewed at a later date. So it's not the same live. And just to clarify, synchronous, the fourth option is live two-way interaction, but with a delivery mechanism. And I know you don't know about Telescope at this point, but a delivery mechanism that is able to actually obtain intraoral images rather than a video chat specifically.
Okay, I'll end polling here. 3, 2, 1. And there's the results.
Ah, great. Okay. We're definitely on the same page here. So about a third. So definitely everybody seems to be more interested in the live two-way interaction, real-time interaction. Asynchronous, I suppose a number of you are already recognizing that you're doing some of this. It could be, you know, reports that have come from a specialist that are reviewed and then communicated with the patient when they, or with the client when they come into your dental practice. That would be an example of asynchronous. And then of course, mobile practice or remote client monitoring might be in a long-term care facility. But I see the majority of you are interested in, okay, how do we get those good intraoral images so we really know what we're looking at? Because, man, I get so excited about this. I'm so passionate about this because it's not rocket science. In order to do an assessment, we need to do more than have a video chat. We need to be able to look and see. So let's get into this a little bit further. So I want to talk about assessment first, and how we do that assessment. So synchronous, again, live real-time interaction, asynchronous transmission of recorded health information to a clinician outside of real-time or live interaction. Remote client monitoring, as we said, you know, a dental hygienist working in a long-term care facility would be a perfect example. And then the live two-way interaction with use of a delivery mechanism to obtain and deliver intraoral images to a clinician via email. Images are then integrated into secure software management. So let's take a look at that a little bit further. So I want to now look at capture. How do we capture? So I'm going to ask Wendy to bring in the first video, and it's a 2-minute video.
The world of teledentistry is definitely here to stay. Hi, my name is Joanne Jones, and I'm a 2020 Dentistry Today CE leader and an international speaker on the subject of oral health. I'm super excited to share with you some of the latest technology on capturing a high-res picture, intraoral photo. Whether you are a patient at home and have a dental concern and want to communicate with your dental office, or whether you are a dental professional looking for an easy, simple system to be able to capture a really good high-res photo, this is for you. So easy to put together on your smartphone. This is Telescope, and it basically just snaps into your smartphone like this, onto the back, and then a single-use tongue depressor clips onto the back, and you have an illuminated source right at your fingertips to be able to take a really good intraoral photo. So whether you're looking at the back of the mouth or whether you want to take a photo on the side of the mouth, let me just demonstrate that for you. I'll just have you turn towards me, and let's get the app open here, and just stick your mouth or stick your tongue straight out. Good. I'll have you turn towards the camera. So I know it's a little bit difficult to see, but the images are absolutely high res and very, very clear. So what you're also able to do with the photo is, if you want to annotate an area of concern or you want to highlight an area of concern, you simply, just remove this, you simply go to the circle area and draw it here, and then you can of course annotate as well. This is then emailed off to your dental home, your dental provider, and you have an easy, quick way of being able to capture a high resolution photo. It's that simple. The world of teledentistry.
Thank you, Wendy. I'll go back to sharing my screen here. And
Joanne, I would just like
yes.
I just want to comment. I think we're having a problem with the chat function. I don't think I'm seeing questions coming in.
Okay.
One person has identified that they're having trouble. I know of for sure. And I just sent a question to all. I'm thinking I'm not seeing the questions either. I'm just going to read out my cell number, and if people can text me if they have any questions. It's
okay, lovely. Thank you.
250.
I did see them initially.
Yeah, 250-960-0424. I'll repeat that again, 250-960-0424. So you can text me your questions as well.
Great, thank you, Wendy. And I was smiling in that video because I did almost, my husband was very proficient at ducking as I almost took his eye out with the illuminated tongue depressor. So a big thank you to my husband for being so patient with me. Okay, so how does Telescope work? The Telescope app works together with the Telescope handle, which is the illuminating tongue depressor. So basically, as you saw, this is the Telescope attachment here, and this slides upwards onto the back of the smart device. So this is just a simple little attachment that is on the back. But if you are wishing to take an intraoral picture, just have a look, I should say, all you need to do is attach it simply the one-time use illuminated tongue depressor. All you need to do is attach it like this. And you can see with the light around my face, it's a high level of light. There's 3 little LED lights that are actually in there that illuminate completely. The reason I love it as a dental professional is I get complete depression of the tongue, so I can see to the back of the throat. And I'm going to show you some images. And also, if you want to use it for retraction, you put it down the side of the mouth. And I've got a very short video that we'll bring up in a few slides to give you an idea of how to capture the image. But it can be used as that retraction tool as well, so you can get a really good intraoral image. So the intraoral image may be captured illuminating the oral cavity and depressing the tongue using one hand. So it's super, super easy to use. The rechargeable handle attaches to any smart device, Android or iOS. So it gives you that ability to take high resolution images. You can measure, if you want to measure an area, you can circle, you can annotate if you want to put some information in. I'll show you that in a moment here. So a lot of capabilities, and then you can immediately send it to a medical office, to a dental office, to any healthcare practitioner seamlessly by just pressing this arrow on the screen, and then your email comes up at that point in time. So it's very, very simple and user-friendly. So this is the resolution. That's probably not as sharp as I've been able to get at times with using Telescope, but with the copy and paste feature, it's a little bit more muted out there than normal. But here you can see quite clearly, there's an area of recession. It was able to be measured. The number comes up 4.8 millimeters. You're able to annotate it's sensitive to cold. So here's another area where there's recession around a crown, and you're able to annotate, circle it, and then say dark area at gum line. So these images can be sent to a dental professional, a dental hygienist, and you can immediately see as you're looking at it clearly what the issue is that your client is concerned about. So can you imagine having them come in for either one of these issues that is so simple to solve, and your recommendations could be made so easily with a virtual consultation. So this is a picture of actually taking this photo versus most of the apps are like this, where you stand in front of the mirror and you are instructed to take a series of photos that will be integrated into a software platform that a dental professional will look at. But the problem is you're not able to get the clarity and be able to annotate and do all the other features that Telescope does. So that is one of the major differences. So very, very easy. The first step is to examine. So you don't have to attach it to your phone at that point. You're just simply having a look inside the oral cavity, depressing the tongue and checking the back of the throat, retracting the cheek, looking at the side of the tongue, whatever area it is that you want to look at. If you do see something, if you were a client at home using it, you would then attach the Telescope to your smart device, capture the photo, and then securely send the image to your doctor or dental practice. So Wendy, I'm going to have you bring in the second video now. This is a 1-minute video. Thank you, Wendy. So let me just go back and share my screen. So a couple of frequently asked questions, and these may be some of the questions on your mind that I'll answer here. Is the data stored securely on the app or servers within the company? The data is stored on the user's device using encryption and accessible only by the app. The data is not accessible by other apps on the device. Does the client have to send the images acquired by the app through a separate method? No, the images may be sent using the built-in operating system share feature. Does the app facilitate two-way engagement in telehealth consultation? At this time, the app is strictly a delivery device, basically a method with enhanced capabilities of delivering superior intraoral photography and annotation capabilities. Does the professional receiving the image also need the app? No, only the user taking the image needs the app. And how do I access the app? It's available. You can access it on Google Play or go to the Apple App Store. So ordering information, and that's in your handout as well. They are taking pre-orders at this point in time for Telscope, and it should be available in the next few weeks. And their website is hollandhealthcareinc.com, where ordering information is available for Telscope. So connecting, when we look at the whole process, this is what I wanted to explain to you. So there are many different platforms that are out there. There are software management programs that are integrated into Dentrix, EagleSoft, some of our main players in the practice management space itself. Or there are organizations that a dental practice can join, almost like a dental service organization, where they are a conglomerate of telehealth providers, Tele-Dentistry and oral telehealth providers. And the client will go in and enter in their postal code or their zip code, and they will be directed to one of the dentists within or one of the dental practices within this group. So there are a lot of different methods. What I've shown you with Telscope is simply a delivery method where a dentist or a dental hygienist could facilitate a video chat with whatever platform they chose to use in their practice through their webcam in the practice, and they could review the images that were sent via email from the client. So that's an opportunity as well with a delivery device and getting a really good quality image. So if we look at the process that a lot of dental practices are offering at this time, the client completes an online form. And basically that online form will say, is this an emergency or is there something that is of a major concern? And they will outline a description of what they are experiencing. Then a team member will reach out and set up an appointment time and then a scheduled video chat. And then if the capability exists, they can also text or email their images to the practice for review. And then the last step is, of course, a customized treatment plan being developed for the client. Reimbursement, and we're going to talk specifically about that in the Q&A for those members that are watching tonight from a particular geographic location. But basically, what's important to know is that teledentistry itself is not a specific service. It represents that alternative method of delivering care. Specific codes have been allocated provincially and state by state for synchronous and asynchronous telehealth client conferencing. Sometimes a limited oral examination, a consultation, or a revaluation code may be used in conjunction with the telehealth code as applicable. But again, a very, very strong call to action that you as a registrant are required to consult with your specific regulatory authority and association for specific guidelines on fee structure. Examination, consultation, reevaluation codes often may only be used by a dentist and/or an independent practitioner who performed the service. So again, I have to give a high-level overview and speak generically to that because state to state, province to province is so different. In summary, in a COVID world, a post-COVID world, or a COVID-free world, implementing telehealth into your practice is a decision I can guarantee you will never, ever regret. And you will find so many different uses for it. The value-added service that will decrease your overhead expenses, open up your chair time, and sustain continued contact with your client base. So at this point in time, in the world we are living in, we have to acknowledge change and embrace it. There's no point in fighting it. So the last question here, if Wendy, if you could bring in the fourth polling question, which will be the first polling question. And we just want to see where your mind is at after completing the webinar. How likely are you to incorporate telehealth into your clinical practice?
Okay, I see people answering. It looks like it's slowing down. Okay, I'm going to end polling in 2, 1, end.
Oh, okay, good. So we're seeing a migration upwards.
That's great.
Awesome. Okay. Let me just go back to my screen here. So I have included as well in your handout the references that were used to develop this webinar. So those are there. And as Socrates said so well, the secret of change is to focus all of our energy, not on fighting the old and what's changed, but on acceptance and building the new. So I wish you the very, very best in your clinical practice and great success in implementing oral telehealth into your practice. Thank you so much.
Thank you, Joanne. I cannot express my sincere gratitude for that presentation. That was excellent and very timely, I think, as we're trying to find our way in this new world that we live in. Just for those that have been asking, we are recording the webinar. We will make it available on our website as an on-demand feature. So please feel free to let your colleagues know if you're interested in sharing. The handouts we will also post on our website, where on the practice resource section. So if anybody needs that information, you can certainly email me or text me. I will list out my phone number again for those that didn't get it. I do have a few questions via text, so obviously our chat function is not working. It's 250-960-0424. So thank you, Joanne. I just want to say sincere thanks. Joanne provided this as a complimentary presentation to BCDHA, and Joanne is a very prestigious speaker, and so we cannot thank her enough for doing this for BCDHA and our members. I do want to address a little bit of the questions about service fees and codes. So I'm just going to take back the presentation here, and I'm just going to go over a few things about billing and codes. So some of the regulatory considerations, and I use the finger with the string around the finger to remind everyone that if you are using telehealth service delivery, that you make sure that you abide by consent, confidentiality, and documentation principles and guidelines that are outlined by the College of Dental Hygienists of BC. We cannot forget that that is an expectation of practice, and it's regardless of how you provide your care and your services, that you maintain those particular parts of the care process. I did reach out to the college and did specifically ask about telehealth service provision for dental hygienists, and they said yes, absolutely, that is possible as long as those elements of care are maintained. So you can be rest assured you're not doing anything wrong by providing care through some type of remote session. Just to give you a little bit of history, this notice came out to Pacific Blue Cross service providers, and the dental code that they were covering was the 05201. Now that's the British Columbia Dental Association fee guide, so that's hygienists would be using that fee guide if they're working in a dentist-owned practice. The dentist would also be using that particular code. So when we saw this, we went, oh, well, that's lovely, and that's wonderful that Pacific Blue Cross would cover that code for dentistry, but are they covering it for dental hygienists, so independent practitioners who own their own practice or work in a dental hygiene practice? We did reach out to Pacific Blue Cross and advocated that they do cover that. So that meant that we had to come up with a code, and I'm going to come back to this in just a moment. But I want to go ahead. So that the 05201 code for 1 unit of time was 5870. That's what Pacific Blue Cross will particularly cover. It can be used for consultations with patients exceeding 7.5 minutes, using telehealth platform, includes medical history assessment, and you can see the other elements of care. The interesting thing is that this code is limited to the consultation performed by a dentist. So obviously the staff in a dentist-owned practice could not provide the oral telehealth service delivery and use that particular code. So for at least for right now. And in conversations with Pacific Blue Cross and the BCDA is that this is really an interim provisional decision. It may or may not last post-COVID, but I think that's an interesting situation that they would only cover it initially for dentistry, but now they will be covering it for dental hygiene practitioners. So we reached out to CDHA, who is the owner of the codes for independent practitioners, and they were suggesting that code 00970, which in the BCDHA, our provincial fee guide for independent practitioners, is $35.75 per unit. I also sit on the National Service Code Committee from a national perspective. Each year, the service codes are reviewed, and oral health service delivery is right now obviously a big element of discussion. So there is discussion all across Canada right now in terms of what will this mean for dental hygiene going forward for the provincial fee guides, and how will this be managed, I guess is probably the best way. I don't have an answer for you yet. We're still in the process of having our meetings and trying to discuss how we can kind of approach this from a national perspective, and then it would come down to each of the provinces to decide what those fees would be attached to each of those particular codes. So I think in terms of where we're at right now, I totally agree. Joanne had one of her earlier slides there said that it kind of, I can't remember the word, but catapulted, I think you used, us into the future. And my own personal opinion is that telehealth oral care services, we were going to end up there one day. I just didn't think we would end up there this year, this month.
Yeah,
this time.
quickly.
But COVID certainly did that for us. And for better or worse, I think dentistry is in a position to, you know, in the adversity really is what can we do to make things better going forward. And that's really, I think, where we're at right now in terms of, and I think, unfortunately, oftentimes I think that dentistry or people in dentistry, we paint ourselves into a little box and we don't ever really see us outside of that box. And we get very complacent into doing what we've always done because that's what we've always done. And I think this is a great time for us to be kind of looking to how can we better serve our patients? How can we keep them more safe? And how can we help out as best we can in keeping COVID from taking more lives? I think that's behooves us to do that. So thank you, Joanne. I really appreciate that.
My pleasure. Very well said, Wendy. Very, very well said.
Questions here, so I'm going to read so here's one. It seems the client is taking the pictures and sending it in for assessment and consultation. How do we get the telescope to the client?
They can order it specifically, or the dental office can carry them as well, and the client can purchase it from the dental office. Either way, it's probably at one point in time I have throat scope as well. We were using throat scope for the Check Your Mouth campaign. And that's another website that I do want to bring to the members' attention, checkyourmouth.org, which was a partnership between the Oral Cancer Foundation and Throat Scope, and it teaches your clients how to do an examination, basically an oral cancer screening on their own mouth. But the best way is to advertise it, promote it in your dental practice, on your website, and then get the client themselves to order it directly. It's the same thing though with a Sonicare toothbrush or an Oral-B toothbrush. Sometimes if we don't carry them physically in the practice, will the client do it? But I believe that when they see the capabilities of it, that the investment in it will be well worthwhile. And if I compare it to, there's another software program, it's going to remain nameless right now, because I know it does have its functionality in certain cases, but they have an intraoral camera that is $199. And the dental practice, the idea is to take that out and use it on a mobile basis, but to incorporate that at $199 for a client to buy, it's not going to be a feasible option. Whereas with Telescope, their pre-order price is around $60. And I'm not sure what that will jump to after the pre-orders are completed, but at this point in time, that provides a number of disposable tongue depressors as well with the system.
Joanne, you might have mentioned this, and sorry, I was reading through some questions. What is the cost of the Telescope unit and the replacement tongue depressors? Do you know that?
It's approximately, at this point in time with pre-order, it's about $60, $65 at this point in time. I'm not sure what that final price point will be. The app itself, depending on the features that are used, is maximum $10 a month, but at this point in time, if you go to the App Store, you can download it for free. So the Telescope app is available. When we look at some of the software programs and some of the other comprehensive patient management systems with the video chat, but not the capability to capture the intraoral photos, a lot of those are, $199 a month for dental practices. So there's quite a range right now. Some are offering free for the first 3 months, and then the user fee comes in for licensing and registration. So buyer beware with something like that. Be aware of any hidden fees. Is it going to increase in a year's time, or is that set at and capped at a certain rate? So there's a number of different things that I would be asking if I was going that route of getting into a comprehensive management program.
Yeah, I remember when I first saw you had shared the throat scope with me. Well, it was at least a year or more ago,
Right.
And I was over the moon excited about it. I remember thinking, because at that point in time I was still working in residential care, and I was like, oh my gosh, every care facility needs to have one of these, and each resident can have their own tongue blade, just like they have a toothbrush in their cup. Because I find when I'm in a care facility, I see a lesion and I go and get the nurse and I bring them in and I look in the mouth. Of course, my light's off and I say, oh, here, have a look at this lesion. And it suddenly occurs to me how dark it is in the mouth when you don't have a lamp or a light.
Exactly.
And the care staff, this is what they're dealing with. They're trying to see a lesion or trying to see something in someone's mouth.
Exactly.
And how can they possibly monitor that?
Yeah, exactly. Yeah. And how easy is this to, bring this over and place that inside the oral cavity, and then to be able to take a picture as well and send it back to the dental practice or whatever you need to do with it. It's just such a simple, seamless transition to be able to capture and examine.
Yeah, I managed to use the just the throat scope and the app on my phone. And
yes, I did that before I got Telescope as well.
And it worked awesome. I couldn't believe how good it worked. Like,
yes,
very little practice. you know, any average person who had what I would say enough manual dexterity to brush their teeth couldn't
Yeah.
manage using the throat scope or the telescope, you know, certainly.
Exactly. And if you're taking the picture on yourself, you're standing right in front of the mirror. So
Yeah.
basically, if I was doing this myself, I would be standing in front of the mirror. I would have the app open. Here it is here. And I would take the picture, you know, as I'm looking into the mirror.
Right.
And it's very, very easy for the average person to do it.
Yeah. Yeah.
But for somebody else to take the picture, if you were taking it on your child or your partner, whatever, whoever it may be, super simple to be able to line
Easy.
that up.
Maybe even easier. Yeah.
Yes, exactly. Exactly.
Here's another question. Is the telescope have rechargeable batteries?
Yes, it does. So this is actually rechargeable on just a regular, I've got my charge cord here. 2 seconds, I'll come back here in a minute. Oh, trying to reach this. And I've just lost my one earbud. But basically this goes into just a regular charging block or cube. And then this fits in like this, and then it's just charged like that. So very, very simple, very straightforward.
Someone made a comment here. It seems unlikely that many patients would purchase this device unless they had some sort of chronic intraoral lesions or maybe mobile dental hygienists using for referrals.
Well, I think one of the best things is clients learn by example. And if you had this in your practice and you used it to take images, which a number of dental professionals are planning on using it that way, the beta testing that has been done at this point in time, several are actually using the telescope to be able to take images, good quality images, and be able to upload them to the client chart or the client file by just using telescope in practice. So if the client saw the use of this and then recognized what they could use, you know, either throat scope for, but this has so many more capabilities with telescope. If they understood that they could use it if they were looking at their child's throat, or if a tooth was coming in, giving the child trouble, having a consultation with their medical professional. We did that actually. My husband had a referral to a dermatologist, and during the very beginning of COVID, all appointments were canceled. And they called and they said, "Do you have any areas of concern? And if you do, could you take some pictures?" So we were able to use telescope and take the pictures and be able to send those directly to the dermatologist. And then a video chat was done the next day. So it's not just for dentistry. It's a device that a parent could use. Every household should have one. Yeah. It just makes sense to be able to look at the throat, look at any oral lesions, anything that's happening inside the mouth. So if I were in clinical practice full time at this point in time, I would have something up about checkyourmouth.org, have that laminated in my treatment room, and have the device and show people what it is and what it's capable of doing. And particularly in today's world, I think many, many people would gravitate towards using that delivery method rather than coming into the practice. This makes sense.
Thanks, Joanne. Somebody's asking, how do you purchase it? Through a supplier or online?
Online. In the US, it is distributed by Benco Dental, but in Canada, it is ordered directly off of the website, and that information is in the handout. So that's hollandhealthcareinc.com.
And just a reminder, we'll make this webinar available online for on-demand viewing, as well as the handouts will be in the practice resources section on the BCDHA website, which is bcdha.com. I'm sure most of you online know how to find our website. I don't have any more questions coming. Do you have any parting comments, Joanne, that you'd like to make?
Just thank you for your time, and thank you for your openness to explore something that I know is very new to all of us. And I think, you know, somebody said to me one time, how do you stay so enthusiastic about the profession of dental hygiene when you're so old? So it wasn't exactly a compliment at the time, but it did resonate with me because it was very easy to answer. And that is a commitment to lifelong learning and bringing change into practice. And I really sincerely believe that that's what keeps us invigorated. That's what keeps us enthused and passionate about what we do. And, you know, having solutions for our clients in today's world is really a gratifying feeling. So I wish you all the very best.
Well, thanks, Joanne. I know it's very late there. Joanne is back in Ontario, so it's after 11 o'clock. I think we're going to let her go. And I just wanted to say thanks to Holland Healthcare as well for being a sponsor. And thank you very much. It was a pleasure working with you.
You too, Wendy. And thank you to all your members.
Yes, thanks to everybody who's attending, and we will sign off for the evening and let you go enjoy a little bit of sunshine that might be left in the province. Okay, so everybody, good night and be safe and be well.
Bye.